All right, students. Well, it's senior year. We're just about there. You got about 57 days before graduation, which seems like forever still, but it's going to be here sooner than you know it. So, one of the last major topics I wanted to kind of go over with you guys and give you some good insight in, or good insight on rather, is data. Now, data we know really is uh, a force that drives healthcare, right? It's in all those research studies that you guys have reviewed throughout your 4 years here in school. It drives the evidence-based practice, but what really is data? Have we really taken a good look into what data is? So, what is data? Well, data is really a data set. Okay, so data sets are all these little um, bits of information that are built from every patient interaction. So what we do, we store the data, we gather the data, we see how trackable the data is. It helps fund, it doesn't really help fund research, but it helps drive research. It improves patient outcomes, and it's how we track outcomes, right? So every patient, every time. So we say we store data. Well, how exactly are we storing data? The electronic health record. So think back to your first interaction in clinical when you were driving through all this different screens, looking at this electronic health record, trying to figure out what it was and why we had to document every little piece of information on our patients. Well, looking forward now, let's fast forward to today as we're getting ready to graduate. You see, the electronic health record collects all the patient data in a central database. That's really what that electronic health record is. It allows for an analysis of the data. So why do we want to analyze the data? Well, we want to look at the trends, right? It's going to help us interpret all of this data because we can have all this patient information out there, but if we can't see trends of, different disease processes, or more importantly, the safety. So, say our patients in, the hospital, and their primary care provider has them on a weird medication or something that could possibly cause an interaction. Well, now having this data for us, having that data available, it can help drive patient safety concerns. It connects the providers with different specialties in different care areas. So, we've talked briefly here about really what data information management and safe healthcare is. Now let's really get into the meat of this, the important stuff. So data itself. What data and for who? So really, if we think about it, we're looking at patient data sets, right? So what's a patient data set consist of? Well, it's the vital signs. Could be if they have a Foley or any tubes or drains, airways, what type of IV access they have, what labs have they had run, what procedures have they had either current or in the past, what medications are they on, have they been hospitalized before? All these data sets start to tie together, right? So that way the primary care provider, who's the main player, shall we say, in use of all this data, can drive their decisions to make sure that they're making sure the patient is safe and optimally healthy. So all that data that we collect when they're in, an acute care setting or when they're even in their primary care office, all that data we collect, we use and analyze. So some of the major key players, well, again, the primary care provider, this data is what drives our patient safety. If they're in the hospital, there's multiple disciplines, right? That's why we're part of the interdisciplinary team. So you have the PAs, the MDs, your PT, OT, social work, pharmacists. Your insurance company becomes a player because, well, with insurance, just like with anything, the data needs to support the interventions that were provided. Otherwise, insurance is not going to want to pay for it. So having all this data helps support the doctor's decision to make sure what they're recommending and the treatment plans that they're putting together for you are justifiable and appropriate for you. They're going to be safe. So a quick little timeline about the EHR and kind of what was the big push behind all this to help collect all this data. It was started in 2010. And the Centers for Medicaid and Medicare, CMS, mandates all institutions by 2021 have implemented an electronic health record. So they've given roughly a 10 to 11 year period for those to have subsidies to help implement these electronic health records so the data can be there. It can improve the safety. So think about when we're doing a medication administration, right? We're looking at our barcode scanners. So that's all data that we're using every time we scan our patient and we give a medication, whether it's an IV fluid bolus, just IV fluids, normal saline, or any medication from a Colace to a Tylenol to Dilaudid, or a high controlled medication. All of these medications are tied to barcodes, and that data helps drive the safety of the patient, right? This is what we're doing. We're instituting these different methodologies to help make sure our patients stay safe, because that's our goal, right? So also with research uses all this data. This is what drives research and in a way can fund the research, right? So if the team sees, for instance, with caudis and pressure ulcers, these were huge problems because everyone had a Foley when they were in the hospital. It was almost commonplace. That has since changed with the occurrence of the electronic health record in those data sets, right? So the EHR was able to take those data sets of those people with Foleys and started to monitor trends and see that the trends were causing these patients to have a higher instance of a UTI that was tied to the catheters. So these are just some numbers of, a simplistic representation. Obviously, these are not true numbers because we're not looking specifically at numbers in a specific institution, but the trend over, since implementation has been a reduction in caudis, and that has been twofold. So Centers for Medicare and Medicaid look at the data and analyzed it and saw that it was costing a lot of money because of these catheter-associated UTIs, right? So again, the data that we were collecting started to show a trend of increased instances in use of antibiotics. So there's been a push from the Centers for Medicaid and Medicare to stop paying for these infections. So the data, the nurses specifically, have been a driving force in research trying to figure out how to reduce these instances. So they've been analyzing the data that's available to them from these different databases and try to figure out, hey, how can we implement an evidence-based change, and the evidence being the data that we have collected, and reducing the instances, getting these Foleys removed. So these collaborations, like we were saying, right? The collaboration, the data set shows these trends in nursing research, nurses have been a huge player in getting these numbers to come down. They use simple statistical analysis. They just saw a trend of, this person had a Foley for 72 hours, and all of a sudden, now they're on an antibiotic for a UTI. So those trends, those data points were able to be connected thanks to the EHR and brought change forth through research. So really, all these data sets, remember, there's one key that we have, right? There's one thing that we're looking at. Ultimately, it's about the patient and the outcomes. And we want to have good outcomes, right? So just remember, our data that we collect, every piece of data that we collect is based off of a best practice protocol and allows for more of a real-time compliance monitoring with the EHR. So we take all this data that we've taken from our patient, every hour, every 4 hours, whatever our assessments are. You multiply that by every patient in the hospital or in your care practice area, and you can take all that data and allow it to be calibrated and compiled and analyzed. So all these data points that we're analyzing are going to get analyzed and have evidence-based practice change based on our findings, our trends, what we need to do to make sure the patient outcomes are improved. So remember, there's the team. This is all a intercollaborative practice with the patient being in the center, allowing for a safer EHR solution and a safer patient outcomes and safer patient practice. So just look there, in the very middle, there's our patient in her gown, and all these teams of doctors and nurses and PT and OT, everyone is in the middle. Everyone is connected to the patient in the middle, looking at that data, basing their decisions on what is best for the patient, because the information is now readily accessible to all the providers intimately involved in the care for the patient. So some of the outcomes that have been proven with nursing research, we've had decreased ODIs nationally, decreased pressure ulcers, decreased drug and antibiotic use. All these things seem little, but they're all from the nurse and the nurse research and the data that's out there and available to us, and trying to cause reductions, because we want reduced instances of these situations. We want to improve patient outcomes. We want our patients to be safer. So by the patients being safer, we're decreasing cost in healthcare. We're decreasing need for time in the hospital. And we're improving the overall health of our patients. So remember, all this data that we're going to collect and all of this data that we do collect on a daily basis. So just remember, like I said, think back to day one as you were, digging through your patient's chart for the first time in that EHR. You were trying to figure out what was going on. Now look forward, and all this data that you've always collected and never really understood why. Now look at what it's done for us, right? We've improved patient outcomes, we've reduced these CAUTIs, decreased pressure ulcers, ultimately improving patient outcomes. So that, my friends, is a little bit of a better insight into data and data sets and information management and safer healthcare. So as we go out into the real practice environments, remember, you are an integral part of this data collection, and you can improve the patient's outcomes with all the data that you collect.